Good afternoon, everyone. Rochelle Seeger with the Foundation for a Healthy Kentucky. I'm thrilled that you're joining us here this morning for this fantastic webinar on COVID-19 outreach. And I will begin our webinar today by thanking all of our presenters for being here, because this is a very important topic that we're covering here today. Welcome to Health for a Change webinar. Honored to be working here at the Foundation for a Healthy Kentucky and coordinating these events. Health for a Change is all about collaboration, as you'll see from our fantastic group of presenters today. A reminder to everyone that this webinar is being recorded, and you can find a recording of the slide decks, upcoming scheduled events on the Foundation's website, healthy-ky.org, on the events tab. Now I'm very happy to turn the webinar over to President and CEO of the Foundation for a Healthy Kentucky, Ben Chandler. Welcome, Ben.
Thank you, Rochelle. It's very good to be with you and everybody else on the panel and in attendance. The Foundation for a Healthy Kentucky is about one thing, and that's improving health in our Commonwealth. And while we focus largely on policy advocacy, we also have a robust effort to share information with the media, the public, and other audiences about health issues in the Commonwealth. One tool that we use is public service announcements, or PSAs. They are video and print messages that we ask media outlets to run. We also create toolkits to help others share PSAs. Others, such as health department directors, community and civic organizations, elected officials, health advocates, and anybody else in Kentucky who we can have help us share the messages that we think are important to the health of our people. The video that you may have seen as you were signing on is a part of the Foundation for Healthy Kentucky's I Got the Shot public service campaign. And the purpose of it is to increase COVID-19 vaccinations among Black Kentuckians. It is designed to affirmatively raise and then respond to some of the most frequent questions and concerns that people of color have about the vaccines. There are several videos in our toolkit, as well as social media graphics like the ones you see on the left of your screen, a Facebook frame, a suggested newsletter article, and flyers that can be printed and posted or mailed. The Foundation is making all of these materials available for free, so you can download and use them. The link is on the bottom of the slide, and we strongly encourage you to make use of any of these materials, because we want to get the message out to people about the vaccine, about its life-saving nature, the fact that it's so incredibly important to so many things right now in Kentucky. It's important not only to saving the lives of our fellow citizens, but it's important for us to get back to some semblance of normalcy in our society. So we all need to pitch in, because we're all in this together. You'll see that we partnered in this campaign with Kentucky Nurses Association, an organization that I've been familiar with for many, many years, and one of the great organizations in our Commonwealth. And the CEO of the Kentucky Nurses Association, Deliner Manson, was one of the members of our advisory committee for this campaign. The committee helped us identify the questions and concerns the campaign needed to address, trusted messengers, and the messaging itself that would resonate amongst Black communities here in Kentucky. The Foundation also partnered with several organizations in creating this campaign called, I think you're going to see a slide now. Is that right, Rochelle? We're going to show a slide right now, or a video.
We all know there's a history of racism in medical circles when it comes to people of color. But with the COVID vaccine, we're all in this together. In fact, did you know a person of color, Dr. Kazmikia Corbett, was one of the lead researchers in developing the vaccine? And there's no live virus in this vaccine. You can't catch COVID from it. That's a myth. I took the vaccine and that wasn't scary at all.
So that's an example of one of the PSAs that we have produced. That gentleman is Tom Bell from Hopkinsville, and he obviously he's one of we Kentuckians, and he's giving the message that we need our people to hear, so that they will go get the vaccine. We also engaged in a second campaign, and we partnered with several other organizations in creating it, and we call it the Take It From Me campaign. This campaign targeted a more general audience. And again, however, it addresses similar questions and concerns that hesitant Kentuckians might have about the COVID-19 vaccines. Both of the campaigns, as I say, feature Kentuckians who look and sound like us, and they live in our communities. They are the experts and the community leaders that, according to the research that we're familiar with and that we ourselves have done, and focus group discussions, Kentucky residents trust for health information during the pandemic. And that's what we're looking for in this whole effort, is to find messengers that people trust. We've got to get over this hesitancy to get to herd immunity, and trusted messengers and trusted messages are extremely important. This campaign also includes multiple videos of varying lengths, as well as social media graphics and a radio PSA. We also added Spanish subtitles to one of those PSAs, so that Spanish speaking organizations can use it and disseminate it to their communities. You can download and use these materials free of charge by visiting the link at the bottom of this slide. Our thanks for that campaign to the Kentucky Medical Association, the Kentucky Hospital Association, and the Kentucky Primary Care Association. They partnered with us on the campaign, and we're very grateful to them. A little later in today's webinar, Noel Copland and Shamaria Morrison will share with you how they have adapted and used our toolkit materials from these campaigns in Western Kentucky. And we are tremendously grateful to them for their efforts to try to make Kentucky a healthier, better place. And now with that, Rochelle, I'm going to turn it back to you. Thank you.
Thank you so much, Ben. And now we welcome to the call Delano Manson, Chief Executive Officer of Kentucky Nurses Association. Welcome, Delano. Thanks for joining us today.
Thank you, Rochelle and Ben. Thank you for inviting the Kentucky Nurses Association to the table for the discussion. As Rochelle said, I am the Chief Executive Officer for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. I think that being involved with this whole experience of building vaccine confidence is definitely something that nurses need to be involved in. You know, the Gallup poll says that nurses are the most trusted profession in the world. In the United States, there are 4.2 million of us, and in Kentucky, about 99,000 of us. You know, I've heard that Dr. Fauci is the most trusted person in the world, but there are 4.2 million of us. So I think that we should be excited about that there are so many of us to get the word out. Some of the things that the Kentucky Nurses Association has done in the last year and some months to get the word out is we provided 27 education classes for nurses, and nurses around the United States actually attended those classes, because we realize that since nurses are so trusted, that it is our responsibility to get the information so that we can share the right information. And so we've been doing the classes on the virus and then also classes on the vaccine, so that when people ask us, that we have the answers at the ready. Next slide. A few things that we've done include our apricot ribbon campaign, where we made 1,000 ribbons and bows, and we did a campaign called the Kentucky Nurses Helping Nurses, which is a web page that we have on our site that people who are needing just an extra amount of, or a little extra amount of emotional support can go there and find ways to build skills and to support their emotional needs. We also designed signs. We printed 600 of them and delivered them to every hospital in the state, as well as to many of the nursing homes, and many front yards have this sign. We worked with the University of Louisville Speed School of Engineering and the Ford Motor Company, and they provided face shields for us during a time when there was no PPE. We had the luxury of working with the Kentucky distillers, who gave us 340 gallons of hand sanitizer when there was no hand sanitizer to be found to be purchased. We rebottled that into 14,000 bottles of hand sanitizer and delivered those around the state as well. So the Kentucky Nurses Association has been pretty busy. And in our recent campaigns, we've been providing volunteers for the Louisville LUVACs, as well as the mini mobile clinics and the testing clinics. So the Kentucky Nurses Association has been on the forefront of managing and addressing this pandemic since the beginning. Next slide. So we know that less than half of the African American population in the state of Kentucky has got the shot. And we are committed to doing whatever we can to motivate, encourage, and support African American, Black, and people of color to get the shot. We've collaborated with the Foundation for a Healthy Kentucky, as been mentioned, and we've also collaborated with the Louisville Metro Health and Wellness Department on a media communication plan. We've participated in panel discussions with groups like the African American Initiative. We've even done small groups like bridge clubs and family meetings to talk about the vaccine and to give accurate information. We've been on the WLOU radio station call-in several times, and we have an extensive social media platform, including Facebook, Twitter, LinkedIn, and we've put information there as well. We've worked with other nurses and doctors throughout the state and with other health departments throughout the state to get the word out about the vaccine, the safety. Next slide, please. So you heard in the short video about Dr. Kamikia Corbett and how she has participated in developing the vaccine. And I'd like to play this very short video that was made by Dr. Fauci, the president of the American Nurses Association, president of the National Black Nurses Association, and other physicians. Rochelle, would you play that video for us? It's an excellent tool to use to share with lots of other people about the vaccine.
Primary message to healthcare professionals is please get vaccinated. It's important to protect yourselves, to protect your family, and as important symbolically as healthcare providers to show confidence in the vaccine so that other people in this country follow suit and get vaccinated.
Physicians and nurses are some of the most trusted healthcare professionals. They can provide accurate information for the consumer regarding the COVID-19 vaccines.
I think people are asking for information so they can make the best decision for themselves, their family members, and other loved ones.
For the last 9 months, we've watched hundreds of people die in both small community and large public hospitals in Miami and across the country. Having to call families of people who have lost loved ones, including parents often, has been hard emotionally and even worse for these families. So to be part of, hopefully, the light at the end of the tunnel by getting the vaccine, helping to encourage others to get it, has been important to me and is honestly a big sigh of relief.
I think it's very important for providers to tell their Latino patients how important getting that vaccine is going to be to their families. The families that have essential workers that have to go to work, students that need to go to school, and we're not going to be able to do that without all doing our part. And getting the vaccine is so important.
To review answers to common patient questions, please search Answering Patients' Questions on cdc.gov. There are 3 kinds of COVID-19 vaccines being developed by Operation Warp Speed. First, we have an mRNA vaccine. The mRNA is combined with tiny lipid particles. We have replication incompetent virus vectors and protein subunit combined with oil and water adjuvants.
It's important to note that none of these vaccines can give you COVID-19 since they only express a protein from the virus that allows your body's immune system to generate antibodies.
Because vaccines are given to millions of healthy people to prevent serious diseases, they're held to very high safety standards.
Both the FDA and the CDC have to ensure the safety and efficacy of the vaccines before they are recommended for use in the United States.
COVID-19 vaccine, just like all others, are undergoing a rigorous process that includes vaccinating tens of thousands of people to generate the data. At the same time, when the clinical trials are underway, the manufacturers, of course, have to develop processes to ensure that they can consistently manufacture large quantities of the vaccine. Once the FDA has authorized the vaccine, then the CDC also has an independent advisory committee that reviews the data before advising the CDC on recommending the vaccine for use among the general public.
So far, we haven't seen any trends of serious side effects. However, people have reported side effects like sore arms, fevers, and tiredness within 72 hours after the vaccine.
When I was asked if I wanted to be vaccinated, I was honestly very excited. I had no hesitation at all. I actually have not had any symptoms, and so I feel pretty great.
Having participated in the clinical trials, I had very minimal side effects, was able to continue to work, without any loss of time or downtime, and have felt fine ever since.
Short-term side effects that were observed in the leading COVID-19 vaccine trials included injection site pain and redness, fatigue, muscle aches and pains, joint pain, and headache.
When one develops these short-term symptoms after receiving the vaccine, that in fact is a sign that the vaccine is working and that your body is marshaling its defense network.
It's actually not possible to get COVID-19 from any of these vaccines because they are not using live virus.
So as you can hear from that short video, first of all, I just want you to know that that's a great resource to share with anyone who wants to learn more about the vaccines. And of course, there's that was made before we did the pause on the Johnson & Johnson, the Janssen. And I want you to know that I have had my vaccine, and on my second shot, I did have a little fatigue, and I had aches and a little chill, but it only lasted for about 12 hours. And I can tell you, COVID would last a lot longer than 12 hours. So even when you get all of that information that you saw in the video, I think the most important thing that we can do to encourage people to consider the vaccine is to respect the messenger. And what I mean by that is we need to listen to the concerns that people have. You know, God gave us 2 ears for a reason, and that's to do a lot more listening than we do talking. So respecting the messenger means that you actually hear what they have to say and what the concerns are before you start addressing what you think their concerns might be. I was actually on a conference call webinar with Dr. Corbett last week, and she was on with the psychiatric physicians group. And she even mentioned that with all of her knowledge, the most important thing that she thinks that she can do to help people know that we want to hear what their concerns are so that we can answer the questions that they have and not try to browbeat them with the answers is to listen first. Next slide. And so one of the things that we've identified through surveys is that Black and brown people really believe and trust their family and friends. And so when they hear from their family and friends that they've taken the shot and what happened, then they're more likely to get it. And so that's why the campaign, the PSAs that the foundation did is so important, because people who look like the Black and brown community are in those PSAs. Next slide, please. And so I went to the CDC because I think it's important that we are consistent about the message. And the CDC had the 6 ways to help build COVID-19 vaccine confidence. And I can tell you that I've heard from several people that they are not hesitant. They just don't know enough, or they don't know whether they should take it or not. So they kind of see, when we start talking about hesitancy, that we're trying to imply that they're not smart enough. And so I kind of changed my discussion to how do we help build confidence? And so I noticed that the CDC had that same type of language on their website. So go back. Encouraging family and leaders in the community to be vaccine champions is extremely important. Having discussions with your families and friends, which I have done on a regular basis. Sharing key messages through multiple channels, like we're talking about the PSAs. You can go ahead. And then the next one is to really share information, but more of answering the questions than just giving information. And then finding credible vaccine information and make sure that you're sharing that on a regular basis. But one of the most important things that you can do is to get the vaccine and share when you're getting that vaccine. Take a picture, put it on your Facebook page, include it in your PowerPoint discussions, and then celebrate it. Next slide, please. There you go. Next slide, please. And so what we need to do is build confidence in the COVID-19 vaccines, and you can get that on the CDC website, as I mentioned. Next slide. And not to throw away your shot. I did another video, and just in case I had time, but I don't. So again, don't throw away your shot. And thank you for the opportunity to share my ideas and opinions with this group.
Thank you so much, Delanor. And I'm thrilled to welcome to our call here, our next presenter is Noel Copeland. Welcome, Noel.
Well, hey, thank you. And I can't thank the foundation enough for helping us to reach our vulnerable and our people of color populations here in our community, which is small, little Mayfield. Mayfield has a population of about 10,000 people. And out of that 10,000, around 69% are white, and around 15% are African American. The other 15% are Hispanic. And so without the foundation's investment made to make first-class commercials, many of our people here would not have been vaccinated. And our cases are on the rise. And, you know, people that have been vaccinated feel that like they are wearing Kevlar. And, you know, that's just a really good feeling. And like I said, I can't thank the foundation enough for making such classy commercials. You know, makes the health department look a lot better than we really are. Let me give you a little background back about the end of January, several of the news people from WPSD TV in Paducah, had called me and asked what we were going to do to reach, some of these populations. Well, first of all, WPSD in Paducah has been a great partner the last 13 months with good messaging, and we have a really strong relationship with them, and they have, tried to help us work through different myths that people see. And so this question that they asked was just going along with what all they had done over the last 13 months. And so what I told them, that we were concerned about those hesitancies in people, but at the time we have over 3,700 people who were over 70 on a wait list, and we didn't have much vaccine. But that I knew that the foundation had a plan that would be better than anything that we could come up with. And so I think that they had conversed to you all a little bit. And so the timing of your all's release for the toolkit was perfect. We had finally received enough vaccine to work through that 70 plus age group, and we're moving on. So I appreciate you all waiting to release that until we did have enough vaccine. And so I'm not going to talk about what all Shamaria did, but after reviewing the commercials that you did, she created her own. And where she is somebody that is well known in our area. And again, another investment by the foundation. And Shamara and I were talking a little bit yesterday, and she asked what the difficulty was on this. And I said, well, it wasn't difficult at all, because of the partnerships in our community and with the foundation. The foundation, made some great commercials. We already had a partnership with Lourdes, and the city councilman, our city councilman has our city council has 3 people of color on it, and one of them, was very passionate about making sure people got the right message and shots. And his wife Ashley works with Lourdes Hospital, and they help with the NAACP and getting information to the churches. So it's been just a really a partnership in a lot of different ways that made things easy to increase those people who are hesitant to get the shots. And as Rochelle was kind of scrolling through some of the slides there, one of the things that the foundation did was that we had access to an electronic billboard. And so, we, inquired with the foundation if they could design a billboard. And, they did that day. The billboard went up the very next day, which was, very amazing to me. I work with government, and government is slow. And for the foundation to be able to do that, it just impressed us all. But as you saw what she was flipping through, there are some of the people with the foundation commercials on the billboards. And then that one that's up, well, flip back a few there, Rochelle. Flip back one more. Can you go back one more? There you go. That's Ashley, who is Derek Parrott, city councilman's wife, that works in cardiology at Lourdes. And then go to the next one. And that is one of the school teachers with Mayfield City Schools who teaches Spanish. And she's helped us all year long. And what hers says there to people, well, was one thing that was very hesitant among the Hispanics. They were worried about ID, having a driver's license, or the Social Security. that it says is there's no charge. They were worried about the cost. And then Miss Godinez got the Foreign Language Club to make the flyers and go around town to, this one was a member of the club that went to the laundromat and posted the same message in there. And so we've really seen a big increase in both populations, and I just really appreciate it. Also embedded in the PowerPoints, if you go back, is Ashley in Crystal's radio broadcast that was done here in the same style and format as the people chosen by the foundation, to do the television commercials. I don't know if you have time to play one of those, but if you do, they did a really good job.
Thanks so much, Noel, and everyone will have all of the links to all of these different presentations and these media spots. After the webinar, I'll send you those links. I'm thrilled to welcome our next presenter on the webinar today, Shamaria Morrison. Welcome.
Hi, everyone, and I'm going to set a timer for myself. I'm in news. I like to speak and I like to talk, so I'm going to make sure I set my timer that I'm on that 12-minute mark. I'm going to go start by sharing my screen, and that is to show you all this, and I am actually going to push that down. All right, let's go ahead and, okay, so let's start. So this is kind of, I'm going to give you all kind of like the background of media and how we talk about vaccines and what's happening in our newsrooms, so that you can not only go back to wherever spaces that you're in, you have a better kind of toolkit on how you can get the stories that matter out to the people, because I don't know too many other stories that are as important right now as vaccines and vaccine hesitancy. So we're going to kind of break it down in this section, what we are, what the media is, what are journalists, what we're seeing, on our side of things, and what we're doing, and then what you can do and what's kind of next with that. So we'll start off with just a quick thing of who I am. I am the weekend evening anchor and reporter at WPSC Local 6. I am from a small town in Clewiston, Florida. One of my biggest passions is advocating for diversity in newsrooms and community-focused storytelling surrounding underrepresented people. And a lot of that comes from where I am. And I have that question, why does it matter? Well, it matters because the people who are in newsrooms, their life experiences and their shared experiences matter a lot with what kind of stories they pitch, right? We were talking a little bit earlier, and I was explaining how, the reason why I asked Noel that question, well, I mean, for me is because I'm a Black woman, right? And when I go home, I talk to my Black aunt, my Black grandma, my Black boyfriend for that matter, and so these are questions that are coming up in my community that I was curious about, and I knew it was likely impacting other communities. So let's start first, and I think this is actually pretty important when it comes to, on your side of things, on knowing who the consumers are, right? Knowing who the people in your community are. When it comes to news, a journalist versus a commentator, and a lot of times you can't differentiate the two, like who's who is your local journalist, and who is the commentator, who at times they have no moral, compass to always tell the truth, right? They're not really into the truth telling how journalists are. We're people who are in your community. And so you have to remember that sometimes the people who you are trying to reach, they don't know. And what you consume shapes your views. So that's why it's important when you're having these messages of vaccine hesitancy, is trying to reach all people on all platforms, no matter what they're kind of listening to, right? Because you don't want to be talking in a circle of the same people who probably already believe you about, the ins and outs of vaccines. You want to get everyone to that local radio show, the TV. You want to make sure that you're varied in who you're reaching out to. Just trust me, I know no journalist who does not want a story. Please, I'm telling you this for all of us. And so I just decided to give you some examples of who your local journalist is from different news stations who even I'm always looking at their their television station and seeing what they're doing with COVID-19 and how they're doing coverage. We have Steven, he's from Wave 3, just started in March 2020, right? And that's like the breadth of COVID-19. I bet he hasn't even met his coworkers yet in person because everyone's kind of working from home. But we always get affiliate stories from them on vaccine. And then you have Catherine over at LEX. And so these are the people who care, you know, they're the people who want to get the truth. So before we get to that testimonials portion, I want to talk about how, like with me and Noel, right? We talked about how me and Noel, we'll sit on the phone for like 30, 40 minutes, right? We just have a 5-minute interview, like even yesterday. But that's important. Find that local journalist in your neighborhood, in your area, who you trust. Get a relationship with them, right? I was telling Noel, when things get into the newsroom, when it comes in via just a press release versus a journalist or I'm bringing it, it brings this level of legitimacy to it that you just don't have with just a regular press release. And the reason why is because they know before I even bring this story up, I found the interview, I vetted out the source, and I'm going to say why it matters, right? And so I've done all the work. I'm telling you all, you find one journalist and you will pump all the stories that you want out of them, and they are going to take it. And honestly, you know, a lot of times there's people who call me and say, hey, I have a story idea. And I say, hey, let's talk through it. I can tell you if it was me, if I say if it's a story or not, or what you need to make it a story. Because there are things that you need to make it relevant to just not one person. And so find your local journalist. That's probably one of the biggest ones. I decided there's a big network of journalists throughout social media, and we all keep connected. So I wanted to kind of get some testimonials of what people are seeing, where they are. So I asked a couple of questions. So how often are COVID-19 vaccine hesitancy stories in your newscast? How is vaccine appointment availability? Do you think your coverage of vaccine hesitancy impacts what viewers think? And what role do you think that we have in sharing stories about vaccine hesitancy? Because as journalists, we care about truth, right? And I don't care whose side it comes from. I just care about the truth. And so I always give this example with climate change. Climate change is real. The science says so. So there is no room for climate change is real and climate change is not, right? There's not two sides to every story when it comes in that aspect. You know, you have to make sure that, and that's the same thing with the COVID-19 vaccine. We can talk about hesitancy, but we don't have to give room to conspiracy theorists, right? There's a two-side story there somewhere, but it's not in those two extremes. So here's this is a reporter from Anchor reporter from West Virginia. She says that they actually don't have a lot of vaccine hesitancy coverage at their station, but she also believes its media outlets should share all sides of a coin, not just the perspective upheld by the majority. And it takes me back to my point, though, of what is the two sides we're talking about? Because we do have a responsibility. And I think for a while, it was kind of a little thrown to the wayside a little bit on, okay, well, I gave the information, but responsible journalism, it matters. We know that it matters, right? Here's another one, evening anchor in Reno, Nevada. So actually, they very rarely have COVID-19 vaccine coverage as far as hesitancy go, but that area has a lot of cases, right? They were one of the ones who Nevada saw a lot because of the workers that were there. But she does think that journalists have a critical role to address hesitancy and meet the viewers where they are, whether it's minorities who don't trust doctors or in rural areas that have limited access. So you see kind of the different type of viewpoints on this. One more. This is from the top news stations in New York. New York is our top market. The most people watch New York stations. They mention it up to 8 times per day, right? And that makes sense because COVID-19 is something that they were the kind of that point of COVID-19 and they were a hot spot. And this will probably be, local media can play a powerful role in vaccination campaigns. They hold regular town hall discussions on their website, and they're devoting a half hour of televised coverage this week to discuss shots and what people should know. So we know that partnerships between news organizations and health departments, they're important because that's a story that needs to be told. It's not, I'm not, I can still hold Noel accountable if something goes wrong, but I can also tell stories that need to be told. And so we have to think about that. And so I kind of wanted to just share, I have my Healthy Kentucky Foundation thing. I wanted to share it, but I think I want to share 1 minute of video from 11 Alive. They're a station in Atlanta, really great station. And they have been doing, they did a whole campaign. And I mean, this was hours of, they got regular people to sit down with doctors, nurses, and asking any question you wanted about vaccine hesitancy. So we're just gonna watch the first minute of it.
Injection site for about
whether to get the COVID-19 vaccine or pass on it. All week long, we followed a local mom on her journey of asking experts and drawing her own conclusions. In the end, Joy Howard decided to get the Pfizer vaccine. I spoke one-on-one with Joy about her decision. So how are you doing after getting the first dose with your mom?
I'm fine, first of all, but I feel like there's a little bit of protection, a little bit of armor surrounding us. So that's comforting to know. We still have another, dose to go. But other than that, we're great.
Any side effects for you or your mom?
No, the only, I don't believe she really had any. I had just irritation at the injection site for about a few hours.
Now I'm gonna stop it here. And I mean, the story, I can imagine they had a lot of people who saw someone who looked like them on TV, and they got to go through all the steps, all the ugly steps, all the bad steps, it's okay for people to have questions, right? We never want to make people feel as though their concerns are illegitimate, because they are legitimate concerns. And so this is the type of work that journalists, who may be watching, can do to help with this vaccine hesitancy. Because again, it's not about one side or the other, it's about truth. And that should be the only side that we want to be on. I'm gonna go to the next one, and then we're gonna round it off here. This is how to pitch news stories to journalists, right? This is what we look for in our pitch meetings. The pitch is, again, like I was telling you all, find a trusted contact first. And this is what you do. Get to the point of what the story is, right? What is the story? Why should people care? You want to get to that as quickly as possible, about why should people care about this? If we want to take, for example, why should people care? And we'll take Mayfield Grace County about people of color getting the vaccine. Well, they're a part of the community, right? And if they don't get it, then you now have a whole population of people who might be spreading it, right? And if we know that they're having issues, well, that's why you should care. That's why someone sitting in their home, we're always asked, why should that person care? Why should people care about that story? And so think about that when you're telling a local journalist why they should have this story. Also, something that always helps is visuals and interviews lined up. Find a person. And I'm telling you, you will get a journalist down to wherever you are in a second. So try to have, either yourself lined up for an interview for some certain times, and even better, who's getting impacted. For us, stories matter on not really too much on who's doing the work, but who is it impacting? Who are the people that you're doing this work for, right? And if you can give us one of those and already have it lined up, well, you've already done most of the fight for us, and we appreciate that. And this is my contact information for anyone who needs it, who may have some additional questions about, forming these relationships with media contact. I would love to help you. And again, thank you, the Foundation for Healthy Kentucky, for having me. And I look forward to a long, long relationship of helping you all whenever you need it.
Brilliant, Shamaria. Thank you so much for sharing that. You guys are getting me energized to go out there and get this done for our whole state of Kentucky. Our final presenter this morning is Verania Rice, Health Department Director from North Central District Health Department. Veron, you're welcome to the call, and I'm pulling up your slides for you here this morning.
Thank you. Good morning. Okay, so I'm going to talk a bit about vaccine hesitancy within the Hispanic population today. So if you go to the next slide, I'll start by telling you a little bit about North Central District and our journey with COVID, because it's important to know what we did as it relates to testing and contact tracing, and lessons learned there that we now apply as it relates to vaccinations. So we're a district health department, and we serve Shelby, Spencer, Henry, and Trimble County. And within our district, there's 6,173 Hispanic residents out of our 92,972 residents. And you can see to the right of the slide, there's a breakdown of where the distribution of that community is within our district, with Shelby County having the largest number of Hispanic residents. In fact, Shelby County has the largest number of Hispanic residents per county population in the state of Kentucky. It has 9.6%. Next slide. So a little bit about our evolution when COVID hit. We had our first Hispanic case of COVID reported to us on April the 4th, 2020. And on April the 22nd, there were 200 out of 254 of our positive cases out of 462 were Hispanic. So the Hispanic population positive cases made up more than half of the total positive cases within the district. At that point, we identified we had an outbreak of COVID within that special population and began to work on identifying what the barriers were and trying to mitigate that. On June the 9th of 2020, you start to see the fruits of our labor. The numbers start to trend down in the Hispanic population as it relates to positive cases. Out of 226 total cases, 89 at that time were positive cases within the Hispanic population. By mid-July of 2020, our Hispanic cases began to dramatically decline. And April 9th of 2021, a snapshot of that was the district had 7,960 total positive cases, but out of that, only 832 of them were Hispanic at 10.5%. So you can see we were able to make a real shift in the trajectory of what was happening within the Hispanic population regarding positive COVID cases. Next slide. So we worked really hard to identify what were barriers for COVID testing in this population. We were able to identify language was one of the #1 barriers. A lot of the promotional things and informational things that were being put out in the community were only in English. And so they weren't getting information and reliable information in a language that they spoke. There were some issues with us getting contact information that was reliable when we would have a positive case and needed to do our contact tracing. Getting information from them about who they had been in contact with was proving to be quite difficult. There was a distinct fear for those in the community who were undocumented about deportation and fear of losing their job. So if they were put on quarantine or isolation and couldn't return to work, they were afraid they were going to lose their job. There were some barriers there as it relates to how they live within a household. Generally speaking, there can be 6 to 8 individuals sharing one home. So when there's a positive case within a home, COVID spreads very quickly without pretty strict mitigation. And there was a lack of understanding on how the disease worked, and most importantly, what were the preventative measures that they could take. We were able to increase confidence within North Central District with this population through a variety of mitigation efforts. We partnered with influential leaders within the Hispanic community. We actually had a Zoom meeting and invited several of our partners to speak with us who were within that Hispanic community to give us information about what they saw were issues. Can you go back one slide? Yeah, there you go. We provided COVID-19 posters and flyers to businesses that were frequented by this particular population. in their own language to help educate about mitigation strategies. We used yard signs that we had in Spanish and placed throughout the apartment complexes and communities that they were living. We also developed some Spanish language care packages. So anytime we had a Hispanic client who was positive for COVID, we assessed whether they had children. And if they did, we took out a care package that had some activities for the children to do so that it would encourage them to quarantine and isolate the household. And we also provided Hispanic videos, so videos that depicted them and was in their language on Facebook to educate them. Next slide. We worked very closely with Hispanic pastors in the community as they are a trusted resource and source for this special population. We provided testing events within the community that they lived, access to Spanish-speaking employees. So when that population would call with questions or want to schedule appointments, they could speak with someone that spoke Spanish. We had mass messaging regarding testing sent out through one of our local partners, Mercy Medical, who is a clinical provider for many within that population. So they were able to assist us in many different ways. And we also went door to door within the community that this population lived and provided letters in Spanish with education about testing and COVID and mitigation strategies and mask wearing, et cetera. Next slide. So as I mentioned early on, the lessons learned from the testing and the contact tracing, we're now applying to our efforts to get this population vaccinated. Many of the same barriers exist as did with the contact tracing and testing. Language, transportation's an issue. Sometimes a lack of technical skills. Many of the appointments systems are electronic and you need to schedule that appointment online. There's still somewhat of a fear if they have an undocumented status about seeking out medical care. They're concerned about will there be a cost and how they will pay that. They sometimes are afraid to ask for time off work to come and get the vaccine, and just general misinformation and rumors within the community, like in any other community, about the effects of the vaccine or the intent of the vaccine. So we're applying some of the same strategies to our outreach and vaccination efforts that we did early on in COVID. We are providing flyers and signage, doing videos, and we're using on our social media posts the PSAs that the foundation has provided us, which are great resource and tools. Mass messaging, we still have our bilingual employees who are handling any calls that come in and assisting with scheduling barriers. We still have those same community outreach partners that were so key to helping us with mitigation before, that we communicate regularly, weekly, via email, to push out information to them, to share with their congregations and friends within that community we're trying to target. We also have had some special outreach vaccine clinics where we target specifically a special population, in this case, Hispanic. One of the things that I noticed early on when we started vaccinating in December, for the first 2 to 3 months, we had very few Hispanics that came to get vaccinated. And one of the barriers there was the phases that we were using. Most of the population living within our counties span in age starting around 50. And so even though we were doing phases that had age restrictions that were higher for the general population, when we did special outreach clinics for Hispanic population or Latinx, we adjusted that to meet more of the criteria of which they function in. So we lowered the age at which they needed to be to get the vaccine. And once we did that, we started to see many more individuals start to schedule appointments or come as walk-ins to our vaccine clinics. Next slide. And so this slide is just illustrating for you some information about what we, North Central District, have done as it relates to vaccinations. The number is not inclusive of all vaccinations provided, as there are many providers that are administering the COVID vaccine. This is just a reflection of what we have administered through North Central. And you can see in the first column, in the Hispanic population, There's a breakout per county of how many have gotten their first dose of vaccine, with Chevy, of course, being our largest county at 212. But more importantly, if you look at the percent of Hispanics or Latino population vaccinated within our district, that has risen dramatically in the last 6 to 8 weeks with our mitigation strategies, with Chevy County now being at 4.41% of that population that we have vaccinated. And if you look in the far right column, that is an indication of the percents of individuals vaccinated in the total population per county. And as you can see, we still have a lot of work to do to get the special population vaccinated, but the numbers are rising daily, and we're getting closer to leveling the playing field, and there being more equity in this population as it relates to vaccine, with our total district vaccination efforts yielding 4.16% in our Hispanic population and 7.82% in the general population. And with that, that's the information I have to share with you at this time. I would like to thank the foundation for the opportunity to present today, and to thank them for the toolkits and the PSAs that they've provided. We have used those on numerous occasions and have applied and received a grant that we will utilize those funds to put those PSAs on the radio and TV and continue to promote vaccination through these types of PSA tools that you've provided. Thank you.
Rania, thank you so much. Thank you to all of our presenters this morning for sharing their time, their expertise, and their experiences with this pandemic year. I'm very grateful. And thanks to each of you, the participants on our call today. Foundation for Healthy Kentucky's Health for a Change trainings are all archived on our website, healthforachange.org. And you can find the recordings, the slide decks, and again, all of the links to the great media pieces that the foundation and our presenters today have crafted for us will be available there. And I'll send you an email with that. In an email, I'll send to you with a post-event survey. Again, immense gratitude to each of you. Please take care. Thank you for joining us today on this Foundation for Healthy Kentucky Health for a Change event. This concludes this morning's webinar. Have a great day.